Hi, Dr. Connie. Hi, everyone. Thank you for joining us today. I'm Krista with Princeton Integrative Health. I'm the Communications Director, and this is Dr. Connie Garofino, our chiropractor and functional medicine practitioner. This is our Women's Health series for Women's History Month, even though it's now April. We're making it up from the other day. And today we're going to be talking all about support for our reproductive health and, through pregnancy and the postpartum period using chiropractic and doula support. I am a newly certified birth, postpartum, and bereavement doula. So whether or not it's during your pregnancy and birth or the postpartum period, or if you have suffered a pregnancy loss, I am certified to provide support through all of those experiences. And as we all know, Dr. Connie is a fabulous chiropractor, and she is a functional medicine practitioner at Princeton Integrative Health. So we're going to talk about all of those types of ways to help support you through the journey of pregnancy and after. So yeah, let's get started. I just wanted to I know I gave a little bit of a background of myself, but since I am newly certified, just to provide a little bit more, I am the communications director, but I also have produced a film called Don't Talk About the Baby, which is all about kind of talking about the stigmas and silence around pregnancy loss. So that's kind of how I got to the doula certification as well, because I wanted to keep working in the birth space, and I thought that that was the best way to do that. So, and I love having the connection with Princeton Integrative Health because it fits right into what you guys do. So I'm happy to be here and talking about all of this today. But let's go ahead and talk about how chiropractic, because I think maybe people don't know a lot, how chiropractic can help women through their pregnancy.
Sure.
So can you talk a little bit about that?
Yeah, absolutely. When a woman gets pregnant and there's no other time in her life that her body's going to go through the massive amount of change that she goes through when she's pregnant and then going into labor and then, postpartum, that entire period, there's so much change that happens physically for a mom. And if you've had any kind of issues in the past or underlying, structural problems, they're gonna rear their ugly head when you go to become pregnant. And even in someone that doesn't have previous issues with and becomes pregnant, because there's so much reorganization and structural changes going on, getting regular chiropractic adjustments it helps to balance, to help the nervous system to function so that everything is up and running when it comes to nerve supply to the uterus, which then is going to help with nerve supply to growing baby, as well as, nerve supplies to the heart and to the lungs so that mom can be having good blood pressure and be able to breathe as her blood volume doubles over the course of a pregnancy. So it also helps with balancing the pelvis. So as baby grows, then your pelvis has to actually shift and change shape. Your center of gravity shifts forward. The rib cage needs to be flexible and be able to open up. The lumbar spine or your low back needs to become more flexible so that your center of gravity can come forward. And chiropractic adjustments help to make sure that all of this is happening with ease so that as baby grows, both mom is comfortable and that baby is in the optimal position to be able to then come out at the end of the pregnancy. We see all the time when, if mom has an imbalanced pelvis and improper positioning of babies, chiropractic care can really, really help with that. And overall comfort and for mom, because it, like I said in the beginning, is in no other time in your life do you go through such massive change so quickly. And then, during labor, chiropractic care has been shown to decrease labor times as well as decrease pain. Chiropractic adjustments for pregnant women specifically help to relax the pelvic floor muscles. So when you do go into labor, there's less of an issue with, tense pelvic floor muscles, which need to relax and open up in order for baby to come through that birth canal. So there is research behind it. It's pretty great. And every pregnant woman should really be under chiropractic care from the beginning.
Yeah, I mean, they're going through multiple different transformations at the same time.
Yeah.
Not only are they growing a new human, but they're turning into a different human too, like, or we, I should say. Your body's changing so much, your bones are moving and shifting, and they, they need the support physically. So that's great that chiropractic is a tool that you can use during your pregnancy to, support your physical body to do what it's, doing at that moment, because there's so much going on, like you said.
So much going on. What about with doula services? Like, how is that helpful for moms while they're pregnant?
Yeah, well, just like you're going through so many physical changes during your pregnancy, you're also going through a lot of different emotional changes throughout your pregnancy as well. Your hormones are shifting, and you, especially if you're a first time or even in subsequent pregnancies, you are preparing for a massive change in your life, one that you may have never experienced before. And then if you are adding another child to the mix, that's going to change a full dynamic too. So a doula is really there to help support you emotionally and in non-medical ways throughout your pregnancy, providing referrals like chiropractic care if you are experiencing, either pain or aches and things like that, and you want to do whatever you can in order to, lower the labor time and get baby in position correctly. So we do things like that. And then, what's I gonna
And
say?
you're there to help through birth as well?
There to help through birth. So full support during birth, labor and delivery. And to help you kind of go over what your options are. I think a lot of the times, especially for me in my first pregnancy, I didn't really know about all of the different choices and ways in which you could give birth, and how many decisions there are to make throughout the entire process. You learn a lot about your own body. I learned that I have an Rh negative blood type, which includes getting ROGAM shots. So there's no, cross, there could be an issue if the baby has a positive blood type. So yeah, there's all these different things, and you can actually work with a doula to go over some of the things that you're finding out about your body and some of the decisions that you have to, make throughout your pregnancy. And then of course, as it relates to your birth and choices you'll have to make for your baby afterward.
Yeah. I had a doula in my first labor, and I think it was helpful because my labor was long. It was
Mhm.
24 hours, and everybody gets tired. I mean, certainly I was tired too,
Yeah.
but I couldn't get out of it. So it was nice to have a doula so that my husband could go and eat something
Yeah.
and take a nap and, check out for a couple of minutes instead of just being the only form of support. Then she was there to kind of step in and
Yep.
help with giving other people breaks. Everybody kind of can take shifts
Absolutely.
or address different needs of mom. And
Absolutely.
I had my babies at home, so even at home, it's helpful to have a doula just as much as it is for hospital births. It doesn't for both.
Yeah, you need yeah, one person can't do it all for that amount of hours, and they can also help you
Well,
in
we can. It's the woman. No,
yeah,
everybody else should get a break though.
yeah, of course. Yeah, they're there for that. They can help with pain management. So whether or not you're, trying to do it without any interventions or pain medication, they can help, because you're going to be in pain eventually. So they can help with pain management through different um, positionings and with birthing balls and just massage, a meditation, holding space
Yeah.
for you to just talk or cry or anything like that. Any type of relief that you're going to get throughout that process is going to be helpful, and that's just an added person there to be there for you. And sometimes the birth partner is like, there's an emotional connection there too. If it's your husband or your partner, it's their baby too. Your life is, kind of in the not in the balance, but there's a worry for them too. So they're there to help support the whole family really as a unit throughout that whole process, to keep everyone, you know, keeping everything slow and calm and as worry free as possible, I guess.
Yeah. And it's hard to, I think, with, like we mentioned in the beginning, that when a woman is getting pregnant and then going to have a baby, it's massive change for her, but it's also massive change for a new dad that maybe has never gone through this before. And to have the support of a doula who's, reassuring and calm is always going to be helpful, so that
Yeah.
men, not that, this is the family structure for everyone, but men intuitively always want to help and fix things, and it's really hard for them to sit back and just watch. And that's one of the best things that you can do during a labor is just let mom labor. And it's
Exactly.
tough to do that sometimes when you see someone that's uncomfortable.
Right. And during labor, things can tend to go either very, very slowly or very, very quickly. So the doula is there kind of just to keep it like at a pace where, even if things get, you know, get quick, get fast, and everything's kind of like, okay, what do we do now? What is there an issue? We're there to kind of like slow everyone down. It's like, okay, let's take a pause for a moment, and these are our options. Like, let's go from there. So
Yeah.
to reduce the panic sometimes that occurs and things like that.
Yeah, to bring in that voice of reason that is not emotionally attached to something that's going on. Do we need to make this decision right now? What happens if we wait? Helping to follow a birth plan kind of
Yeah,
thing.
yeah, and we can help develop the birth plan too, because there's a lot that goes into it. And I don't think, again, my first pregnancy, I had no birth plan whatsoever. I was like, I'm just going to see how it goes. Like, and so, you learn through that. You're like, okay, there's so many different ways in which it can turn. And, I had long labors too. So there was, this need to try to speed things up, especially in a hospital setting. And so I think doula helps to slow things down, and, I think it's better for everyone.
Yeah. It's definitely so helpful to have that added support.
Yeah, for sure.
Mhm. So what about postpartum?
Yeah, so we can go into postpartum. So of course, postpartum is like the forgotten period. Everyone's buying baby gifts, and we're so excited for the baby, and then we don't really prepare for the recovery, the both emotional recovery, physical recovery that a new mom is going to go through, a new birthing person is going to go through. It can be so different from person to person, but it's really, really good to have another support person there, especially if you don't have family help. If your partner's going back to work immediately, you can't do it alone. It's really hard. So it's good to have someone there to, again, especially if you're a new parent, just to bounce your, what you're going through off of them. Like, is this not right or wrong? I don't want to say that, but just to help you, guide you, and support you. If you are physically, in pain, and you can't lift certain things, or even, it's hard to lift the baby sometimes. It's hard to go up and down the stairs. So I'm there to help with the laundry baskets and to do some of the like light
Going up and down the
housework.
stairs either. Yeah.
What did you say?
And you shouldn't be going up and down the
No,
stairs.
you should not. It's really a period of resting and bonding with the baby,
Yeah.
focusing on nourishing your own body so you can nourish your baby's body, and feed them and all of that. So the least amount of any physical activity you can do really within those first 40 days.
Yep.
I think there is this very strange, I don't understand it, like culture in our country that is pushing women to bounce back and get back to work and get their body back and all of these things, as soon as possible. And the time flies. It feels, when you're in the moment, like every day is a year, and it feels like it's like Groundhog Day, and days are blending into nights and all of that. But it's really a critical time that goes by fast that, you can use to help your body recover. The foods that you eat should be nourishing and warm and, just nutrient dense.
Yep.
So that you can, if you are breastfeeding, have, be able to continue your supply and feed the baby. So
yeah, it's true. It's such a sacred time that
it really is. Yeah.
gets passed over often. When my babies have been born, my midwives have said, don't get out of your pajamas for a week. Shower when you need to shower, but get right back in your pajamas and then get right back in bed. Everybody can wait on you, do nothing, stay in bed with your baby. And then you can start to venture to maybe the couch, and then you could go to the porch, and then, but for those first 40 days, you are staying as low and slow as you can. It's so important for the healing process.
It really is. Yeah. Again, with my first, it was not, I was like so ready to have the baby so that I could just, not feel so heavy and all that. And, I think it was like a few days later, I got in my car to drive to Target or something, and just pushing on the gas pedal And I did not have a cesarean, but just pushing on the gas pedal was like, whoa, I should
Yeah.
probably rethink this.
Yes,
I
exactly.
did not expect it to be so sore, and just the little physical things that, you know, are you take advantage of and you think are so easy are a lot harder when you're recovering from that type of
Right.
life experience, for
Yeah,
sure.
I mean, even going up and down the stairs, is not recommended.
No.
You
Yeah.
plant yourself somewhere and then have everybody else wait on you,
Yeah.
whether that's, family, or if, like you said, you don't have family, then that's what the role of a postpartum doula is amazing for.
Okay. Yep. And we can help with sort like, you know, breastfeeding assistance and things like that. It's very hard. It's not something that just comes easy to most people. Lots of challenges that you can face. So it's nice to have someone to guide you through that. And if you need additional assistance, again, we're a great resource for additional referrals. So if you need a lactation consultant or, you know, someone like that to help you, if it's more of a challenge than what a doula can help with.
Right. Right.
Yeah.
Yeah.
What about chiropractic care? How is that beneficial during the postpartum period?
Well, like we've kind of already been talking about, labor and birth is traumatic, period. No matter what kind of process happens, whether it is a normal, natural, unmedicated vaginal birth, or if it's a, cesarean section or with an epidural, it doesn't matter. It's traumatic for both mom and baby. So there is healing that needs to happen. One of the beautiful things about pregnancy is we have this lovely hormone that's pumping through our system called relaxin, and it does exactly that. It causes all of our ligaments and tendons to relax, and over the course of about 4 or 5 months following pregnancy, it starts to dissipate and go away. But during that crucial postpartum time, it's a great opportunity to get chiropractic care, so that as almost everything sort of comes back together, it's coming back together perfectly. We see a lot of women that maybe have had issues before pregnancy. If they're getting adjusted following, those issues never return because their bodies are able to adapt and process that after going through birth. With babies, it's a traumatic process, even in the most natural births. So babies come and they get squeezed through that birth canal, and then they are, their lungs get expelled, and then they take these big breaths. And if there's any kind of strange rotations that happen, if positioning isn't ideal, if there was any kind of intervention, we get a lot of strain and stress in those top couple bones in a baby's neck, a lot sometimes in the cranium, which then can lead down into the jaw. So anytime babies have any kind of colic,
Yeah.
digestive issues, latching
Right.
problems,
I was gonna say
chiropractic care is probably one of the number one interventions that needs to be considered, because even just one adjustment can help clear up all of those things, and then baby can latch and nurse, and then everybody's happy. There's so much less stress when babies are able to nurse.
absolutely. Yeah.
Yeah.
I feel like there's a lot of extra, you know, when you're trying to feed the baby and then, you know, you're not getting enough, and you have you're pumping as well, and then, you know, you're doing all these different things, and then maybe supplementing with formula. It's so you know, you got to do what you got to do to feed the baby, right? So you do, but if you can get that baby to latch and just feed them from your breast, it's not, I'm not saying it's the best way to do it. I'm just saying it's easier. It's like, you know, you're getting the milk comes out of your breast the most efficiently. You know, it's just the way to yeah.
Simulated exactly how it needs to be, right temperature,
Yeah.
There's
Heating bottles. Yeah. I mean, again, I've done it all, and it's a lot of steps.
yeah. And it's truly one of the miracles of chiropractic to see a baby come in that's not been latching and is having a really hard time, and mom is super stressed out, and I adjust them and then they latch, and it's the most, it'll make me emotional just talking about it, because I've seen it happen so many times, and it is truly beautiful.
Oh my gosh, that is so beautiful.
Yeah.
That's so nice that you can help people get to that.
Oh my gosh. It's
Because it's
incredible.
so hard. I mean, for me, I only fed him with a nipple shield. Like I didn't even have it never happened. And it was fine. You know, we did it, and he got what he needed, and that was fine. But with my second, I started him with that, and one day he just peeled it off and he latched on, and I was like, wow, okay, this is different, you know? So it's
That's
funny
great.
how you just kind of like, it's different with each child, but I didn't know that chiropractic could help with that. So it's just so great to know that there's so much more to chiropractic than, adjusting your spine and, helping you with back issues. It's really like a full
Yeah,
body, healing,
absolutely.
healing modality.
Yeah, kids respond so fast. Even when they start teething or start getting ear infections or things like that, it's always my advice, bring them in before because and it clears up so fast. It's amazing. Yeah.
Wow, that's awesome. Yeah, I think and another part of the postpartum part for doula support is that we can help with, you know, basic infant care as well. I think a lot of us, we're like, okay, we have the baby now. What do we do? Like, I mean, you can read all you want, but once you're on, hands on, it's a lot different, and each baby is so different. So we can help with that basic infant care. Learning how to, help with changing diapers, help with feeding, help with bathing and things like that.
Yeah.
So it's
And
really
even just
just,
the emotional support,
yeah,
uh, of knowing, is this normal?
right.
Should I be experiencing this? Is it okay that this is happening? There's so many moments like that early on that you really have no clue. So to have
And, and
somebody.
and it is an emotional period. You are going through a hormonal shift again,
Okay.
and so I think we're there also for the emotional support, to listen, to just be there as a witness, kind of to everything, and then to see signs. If there is signs of postpartum anxiety or postpartum
Right.
depression, to get you the help if you need it, because it's very common. It's nothing to feel shameful about or guilty about. It's a normal, just part of it all. And
Can
it
be.
doesn't happen
Yeah.
to everyone, but when it does, you should obviously seek out, the help you need.
Right. Absolutely. Yeah. Yeah. Yeah.
Anything else you wanted to talk about as far as the chiropractic part of? I mean, there's so much that we went over. So thank you so much for all the information, and I hope that um, you know more people seek out that type of care during their pregnancy and postpartum period.
Yeah, it's a wonderful, addition to just overall health and wellness and how
Mhm.
to support a healthy pregnancy and postpartum period, and then making sure that baby gets off on the right step. And we didn't really, I guess I didn't mention this, but it's interesting how it's such a tough time for mom, because she's been carrying this baby in her belly for all these months, and then goes through this major traumatic event physically, and then the next day is supposed to pick up that baby and carry it around, and then continue to take care of it from her own body. So
Yep.
chiropractic care during that time is so helpful, because your body is going through so much again that it's
Take
just
care of it.
constant demand. So yeah, take care of it. I mean, that book, the first 40 days, that book is like incredible.
So good.
40, the first 40 days for 40 years of health and wellness is kind of the saying. And
Yeah.
so making that a real sacred time so that your health can be great for the next 40 years to take care of these beautiful children that you've now created.
And it has amazing recipes, everything
Yes,
from
yes.
bone broth and stews to
Yep.
smoothies, and even like
Blood cutting.
skincare.
Great. I know they've got the tinctures and the herbs,
Yeah.
and
Sitz
yeah,
baths and all of that. Yep.
it's a good one.
I did want to just ask you, you did a blog recently where you talked about how chiropractic helped you during your pregnancy, actually. Would you mind sharing a little bit about that?
Sure. I mean, I had chiropractic care through both of my pregnancies, and I have a history of low back injuries because of horseback riding, and wasn't really sure what my body was going to do when I became pregnant, because I kind of suspected maybe I would have issues, but I did. I went and got adjusted every week during my first pregnancy, and then same thing with my second, and it definitely helped. I mean, I could tell when I started there's different growth periods that are bigger for pregnancy. Usually that 12 to 15 weeks is the first big growth period for baby, and then 20 to 25 weeks is the second. So with me, if women are going to experience discomfort, it's usually in one of those windows, if not both. So I usually recommend starting to get under chiropractic care somewhere between 10 and 12 weeks, because then we can sort of catch it before anything starts to happen, before those big structural changes really become an issue. Um, so yeah, I was adjusted through both my pregnancies. I've had two successful home births. The first one was definitely longer than the second, which is pretty expected, but both of them were normal and exactly what I had hoped for. And then continued to get adjusted afterwards. Both of my babies were adjusted within minutes of being born. And I've breastfed both of them. My first one, he weaned himself at about 16 months, and then the other one, we're still going strong at 13 months. I'll probably have to kick him off at some point. I don't know when.
I had to with my third also.
Yeah, exactly. So
those last ones are a little attached.
that's how I feel. It's not, I'll end up being the one that ends it. We'll see.
Yeah. Well, thank you for sharing your story. And if anyone has any questions, I'm going to just check on Facebook to see if we have any. But, the Women's Health series is technically over, but we're going to keep on doing lots of different topics like this. If you have any topics that you'd like to hear about, please let us know.
That's a great thing. If anybody has anything that they really want to hear about, please let us know, because we're always looking for great topics. And, this one definitely hits home for both of us, right, because of our lines of work. But if anybody is curious about other things, just let us know. We'd love to talk about whatever.
Absolutely. And April actually is, I think we talked about Stress Awareness Month. So we're going to do some topics around stress this month. I think we can all use any resources that we can to reduce our stress in our lives. And we've talked about that on our Just for Health Success series. So we're going to talk more about stress. We'll definitely talk more about these topics if it's something that people want to hear more about. Katie is watching us right now, so hi, and thank you for joining us. Yeah, she was agreeing with a lot, and a lot of and explain to people, I think that was kind of a point made earlier. A lot of what you go through in a pregnancy and afterward isn't talked about enough and isn't explained as you're going through it and preparing for the postpartum. It's not talked about either. So any enlightenment we can provide to help anyone who's either going through it or about to, we're happy to help, because it's hard and people need help.
And you don't even know what you don't know,
Right. Exactly.
Until you're in it. I mean, I've had moms come to me and say, I didn't even know that there was, postpartum bleeding that happened for weeks. Yeah. And they just didn't know. And so, it's important to have, I think, conversations like this that maybe not everybody wants to talk about, and they don't, but it's all things that are so important for moms to know and for parents to know going into this giant decision that they're making, and big change in their life.
100%. So we're going to talk about all the things that other people feel weird talking about. I think that's the goal here.
Yeah, that's great.
All right. Sounds good. Thanks, Connie, for joining today, and thank you for watching. And we'll have this up on YouTube and our Facebook page eventually, and you guys can share it. And we'll let you know when the next event is.
Thanks, Krista.
Thanks, Connie. Talk to you soon. Bye.